This segment is sponsored by Coastal Wound Care. Coastal Wound Care has a new location in North Charleston. Dr. Timothy Gregory joining us with much more. Good to have you on the show with us, sir.
Thank you.
Yes, sir, absolutely. What sort of wounds do you treat?
We treat all wounds, head to toe. Anything from a diabetic foot ulcer all the way up to post-surgical wounds. It runs the gambit. So basically, any wound, head to toe, we treat it.
When should a patient be seen at a wound center versus the primary care provider? I was thinking about that when you were just talking.
Yeah. So, a lot of the minor wounds, you will probably go to your primary care provider first, which is certainly appropriate, or you can go to an urgent care clinic, that kind of thing. I would say typically the number is 4 weeks. If you have not, if your wound has not healed in 4 weeks' time or gotten significantly better, that's when you should really reach out to a wound center. I'd also say that for wounds that are particularly large or complex, I probably wouldn't wait 4 weeks at that point. I'd probably give us a call.
Because things can get worse fast.
Things can get worse fast, and in particular, diabetics who have foot wounds, those are at high risk for amputation, and I would probably see a specialist, whether you see a foot surgeon or you go to a wound clinic. That should probably also happen that should happen pretty much right away. Once you know, if you're a diabetic and you have a wound on your foot or lower extremity, you should be seen by a specialist.
I think that kind of steps right into the next question. Can advanced wound care prevent limb amputation?
It certainly can, and again, going back to diabetics, depending on what study you look at, the 3-year mortality rate in a diabetic who had a below knee amputation, at 3 years it's anywhere from 35 to 65% mortality rate. So, as high as 65% of diabetics who get a below knee amputation will not be alive at 3 years. At 5 years, again, depending on the study you look at, it's anywhere from 39% to 80%. So those are high numbers. Those numbers are worse than certain types of cancer. What we can do at the wound center, we have all kinds of technology and advanced medical devices, so to speak, at our disposal. So we have a negative pressure wound therapy, which people refer to as a wound vac. We have skin substitutes, which are basically artificial skin.
Oh, wow.
And a lot of these things can help heal a wound and prevent that amputation.
You see a number of patients that do have problems with diabetes and are diabetic, and when you treat, what are some of the wounds that they have, or what are some of the things that maybe fester up on their feet that need to be taken care of?
Well, a lot of diabetics will have, the wounds will be deep. They don't have a lot of feeling, or maybe no feeling at all.
In their feet?
Nothing. They'll step they'll step on a nail, they don't even feel it. And so some of these wounds go all the way down to bone, and then the bone becomes infected. And when that happens, that complicates things quite a bit. So it certainly would require antibiotics. It could require surgery. Worst case scenario, which is obviously what I and the folks at my wound center wish to avoid, is amputation. But yeah, in diabetics, it can be very serious.
The main thing is that when a wound needs to be taken care of, it's good and it's better to see a specialist that deals with that, right?
It is, yeah. Like anything, if you had a problem, you had an itchy eye, you'd go see a primary. But if they decided that is something that's significantly more than complicated than what they can handle, they'll send you to an eye specialist. Same thing with wounds. You have a wound, especially if you're in a high risk group, you would need to go see a wound specialist.
How about referrals? Do you need a referral from your primary doctor if you have a wound to go see you, or can you just call and make an appointment and say, I think I got an issue going on?
You can just call and make an appointment. You do not need a referral. One exception would be, well, two exceptions. One would be if your medical insurance is with an HMO. They would need approval usually from the primary doctor, and Veterans Affairs patients also need approvals.
Oh, fantastic. Good to have you here with us. Where's your location in North Charleston?
It's off of Netherby Road, so it's in the same little medical complex that has Urban Nirvana, a massage place. So
Yeah.
after your wound care, you can go on over there, I guess. But
Fantastic.
plug for them. But
Yeah, very good. Dr. Gregory, thank you so very much. Go see this
Thank you.
gentleman and his crew that he has. They specialize in wound care. We have more Lowcountry Live right after this. Stay with us.